This is the case of doubly committed subarterial VSD. We previously call it outlet VSD of supracristal variety. In this VSD, no tissue is present between aorta and pulmonary artery above the that means just below the VSD. So VSD is present both below aorta and pulmonary valve, and there is no tissue remains between aorta and pulmonary artery. That is why we call it outlet VSD and supracristal, because no tissue remains there. So directly VSD is just below the aorta and pulmonary artery. So in that case, what you have to do, this kind of VSD is always gets complicated if it is not closed timely. So VSD, in this kind of VSD, surgical closure is only one option, and it is to be closed early. You see the VSD located just below the pulmonary artery and aortic, pulmonary valve and aortic valve. The no tissue remains between aortic valve and pulmonary valve. That is the important point to note in this type of VSD, doubly committed subarterial VSD. This VSD always needs surgical closure. If it's not closed early, the aortic valve is damaged because of the blood flow from left to right ventricle. With that intensity, the aortic valve tissue is dragged and trapped within this VSD, and finally damage to aortic valve happens, and that will lead to AR. So whenever AR is significant in this case, then patient will get aortic valve aortic valve replacement, and that needs care for the lifetime. But if VSD is closed early before the aortic valve gets damaged, then that is one time procedure. If it is closed by surgery, then child will get cured for the lifetime without any further medication. But if aortic valve is damaged, then aortic valve is replaced with the closure of VSD, then that child will need long-term anticoagulation to prevent thrombus formation near the metallic valves, replace metallic valves. So that is a point to note. This so in this VSD, what you see, the LV is relatively D-shaped. So right ventricle has got more size. In case of VSD, that means pulmonary pressure has to be more. And if you see this flow is right to left, indicating right ventricle systolic pressure high. Ultimately, case has to be operated early so that patient does not develop irreversible